Now we are going to look at the CT features of chronic suppurative otitis media. Picture A shows the pathology, and you're going to compare it with the normal side in picture B. A and B are the coronal images, whereas C and D depict the axial images. So here in the normal picture, we see the semicircular canals, we see the ossicles, we see the attic of the middle ear, and this is the middle ear cavity, and this is the middle ear cavity, tympanic cavity, and this is the mastoid air cells. This is the inner ear. You can see there is a hypoattenuation, presence of air in the middle ear cavity. Okay. Now in otitis media, the eustachian tube is normally blocked, and because of that there is negative pressure in the middle ear cavity, and the pars flaccida or the of the tympanic membrane acts in accordance with the negative pressure and pulls in. There is normal physiological toilet available for the desquamated skin cells of the tympanic membrane, but when this pathology occurs with the obstruction of the eustachian tube and the in-pulling of the pars flaccida, the cells, desquamated cells, start accumulating and form a ball of skin called keratoma, which is more frequently and incorrectly called a cholesteatoma. This keratoma, also known as cholesteatoma, can enlarge and cause bone destruction. So we can see here the lower attenuation present here is absent here, and it is filled by a mass of higher attenuation than in the normal picture, and this mass causes erosion of the semicircular canals, and this mass also has destroyed the ossicles, the no ossicles here, and covers part of the oval window on which the stapes is normally located. Footplate of the stapes is normally located. So this is the keratoma or cholesteatoma, which is the pathological lesion causing bone erosion. That is why this, you can't see these well-defined margins and the semicircular canals. So there is bone erosion here, affecting the or eroding into the area of the semicircular canals. Okay, so this is the case of chronic suppurative otitis media. So mass erosion, destruction of the ossicles, replacement of the normal lower attenuation picture because of air by a soft tissue attenuation. These point towards presence of otitis media, and this should be correlated with clinical findings, which is usually a ear pain, ear discharge, which is most commonly purulent, bloody discharge, And now we come to the axial image, axial section, CT section of the middle ear, temporal bone. Here this is the normal middle ear cavity. You can see the hypoattenuation throughout. We can see the mature hair cells, and we can see the inner ear, but you can see the malleus incus. Here we can see the mass, which has replaced the lower attenuation with the soft tissue attenuation, and the ossicles are not there, they are destroyed. The ossicles are present here. These ossicles are replaced here. There are no ossicles, and the mass occupies the middle ear cavity and also impinges on the oval window, and also shows erosion of the semicircular canal area. So this is a picture of chronic suppurative otitis media. So always compare with the normal side. If it is unilateral or if it is bilateral, look for opacities in places where there should be a normally hypoattenuation because of presence of air in the middle ear cavity. Look for the malleus incus and stapes, whether they are there or destroyed, and also look for erosion. So chronic suppurative otitis media is considered safe type if there is no bony destruction, and unsafe type if there is bony destruction. So this is a case of unsafe chronic suppurative otitis media.